when healthcare becomes difficult, consumers increasingly will go somewhere else. If it's too hard, they're going to go somewhere else. Friction shows up as long hold times, difficult scheduling appointments, repeating information multiple times, confusing bills, poor communication. But the good news is that many of these friction points are solvable. We know they exist. They're not a surprise to us. The challenge is that healthcare has normalized many of them. What we found is that you could have the most compassionate care team, but if the patient struggles to get in to see you, they're going to leave.
Hello and welcome. I'm Chris Malone and I'll be your host for today's discussion, and I really appreciate you joining us. And before we begin, I'd like to welcome our friend, colleague, and program partner, Lori Speaks, Chief Experience Officer at PRC. PRC partners with healthcare organizations nationwide to improve the healthcare experiences for patients, physicians, and employees by helping leaders turn insight into meaningful improvements in care, culture, and outcomes. Welcome, Lori. What can you tell us about our guest today?
Thanks, Chris. I'm excited to introduce Jen Carron today, who's the Patient Experience Officer for BJC HealthCare, one of the largest nonprofit health systems in the Midwest. In her leadership role, she helps guide enterprise efforts to improve patient and family experiences across a complex network of hospitals, physicians, and care settings, with a focus on culture, service excellence, caregiver engagement, and relationship-centered care. Jen's widely respected for her ability to connect operational improvement with the human side of healthcare, helping teams translate empathy, communication, and trust into measurable improvements in care experiences. Throughout her career, Jen has championed the idea that patient experience is not simply about satisfaction scores, but about creating environments where patients, families, and care teams feel heard, respected, and supported. Her work emphasizes the importance of leadership visibility, frontline empowerment, and culture alignment in delivering consistently compassionate care. We're delighted to welcome you here today, Jen.
Thank you.
Great to have you, Jen. So to get us started, we would love to hear the story of how you came to work in healthcare and patient experience in particular. How did all that come about for you?
Yeah, Chris, thank you for having me on your show today. Ironically, when I was younger, I would get sick going into hospitals. Just the smell and the environment would make me just nauseous. And so it's ironic that I'm here today and I'm enjoying every time I do go to the hospital. But I was in the military at the time. My husband was in the military. And as many military families, our children would go back home to spend the summers or Christmas with our extended family so that they could build those relationships with grandma and grandpa and their aunts and uncles and cousins. And this particular summer, when my son was 5, he was diagnosed with strep throat on a couple different occasions. And the night before I was supposed to pick him up, my mom called and said that she thought AJ had strep throat again. And so I took him into his pediatrician. And for anyone who's had children, you know the drill. Take antibiotics for 10 days, come back and see if they're not better. And so as the week progressed, I noticed that it really did not present uh, as what we thought it was. And so he started to have swollen joints, low-grade fever, and complaining of just overall body aches. And so on Friday, I took him back to the pediatrician for a same-day appointment. And the pediatrician, without looking at him, said, "I told you to give it 10 days. You need to go home." And so I did. I wasn't in healthcare at the time. I was a young mom and very compliant. And when Sunday came around, I was cooking dinner. I remember it as clear as day. It was 6 o'clock, and I called him up to the table, and he didn't come. And then I called him again, still no show. And I found him on the couch crying, and he just said, "Mama, I can't walk." And so the very next day, I went back into the pediatrician's office, and I said I wasn't leaving until I had a referral to somebody who gave a shit. I probably would have popped up on workplace violence, today because I was very adamant I was not leaving. And by the grace of God, we had a referral to Nemours Children's Clinic in Pensacola, Florida. Shout out to my friends down there. But what started off with the pediatric rheumatology visit ended with the pediatric cardiologist direct admitting him to the hospital for heart valve issues. And so we go over to the hospital, and the nurse comes in and she said, "Jen, we're a teaching hospital, so you're going to have a resident care for your son." And so I'm sitting beside the bed and I'm praying because I do not want a student, someone who doesn't know what they're talking about or what they're doing, looking at my son. I've fought healthcare to get here, and now I'm a full-on advocate. And as I'm sitting there, this young gentleman walks in with a long white coat on and pulls a chair up and sits knee to me. And he said, "Miss Carron, I see you like to be called Jen. May I call you Jen?" Now he has my attention. And I didn't know what bacterial endocarditis meant. I didn't know what rheumatic fever meant, but he explained it to me in a way that I could understand. And he held up his hand and he said, "A normal heart valve opens like this. Your son's is waving, and these fingers, we believe, is bacteria." And in that moment, I turned from an advocate to being a full-on partner. I knew that there was no other place that I wanted my son to be. And so I would have been that mom at the nurse's station. Medications are 5 minutes late. What are you guys doing? But I knew that it was okay if they were 5 minutes late because I had full trust of the care team. And so I spent many weeks with my son in the hospital, and I watched and I observed what ideal care looked like. And from that experience, it changed the career trajectory. I knew that I needed to go into healthcare so that I could create that same collaborative experience for all families that needed help. And so I quickly changed. I would say that my son being there, I overcame getting sick. I mean, that thought never crossed my mind, and it hasn't crossed my mind a day since.
Wow, that's amazing. And for those of us that had young children, of course, you know how scary that can be when you feel helpless and you know something's wrong and you're not getting where you want to. So we're so glad that you made the transition into healthcare and the difference that you're making for all of us now. Now, for those who may not be familiar with BJC HealthCare, I was wondering if you could tell us a little bit about what states, markets, and types of patients you serve there.
Yeah, so BJC Health is headquartered in St. Louis, Missouri. We have clinics, 24 hospitals, home care, hospice, behavioral health, the whole gamut, pediatrics and adults across Missouri, Illinois, and Kansas. We serve rural, urban, critical access, the whole spectrum. And so serving our population across the Midwest is our mission. 11 billion organization. I think if you're looking for healthcare in the Midwest, we are definitely the place to go.
All right, good to know. Good to know. Now, given your son's experience and how you came into healthcare, I know that you've also previously said that kind of healthcare is still far behind other service industries when it comes to customer experience. And I wonder, what are the things that you think are the big differences there, and how does that impact the expectations that patients and parents bring to the care environment?
Patients don't expect healthcare to be fast. When we ask them what they want or what they need, what they're looking for, it is the same experience that they have when they're ordering DoorDash or Amazon or Uber. They want to be updated, they want to be seen, and they want to be valued. And so, the expectation gap isn't really about healthcare itself. It's about communication, visibility, and reducing uncertainty. And these topics had historically been probably secondary or tertiary to the design of care delivery. Patients are consuming healthcare the same way that they consume other services, and they expect us to deliver on them. I can give you a real example of how we've taken this deep understanding of what other organizations outside of healthcare are doing and apply it to healthcare. And so, an example of this is, when you look at the wait experience. And so, whether it's DoorDash or Amazon, they intentionally design wait. They know that it's going to happen. Disney is probably the best in the industry in creating a wait experience. There's a reason why the average family of four will spend $2,400 and wait in line for 8 hours. It's because they don't, it's not like you're waiting. You are still experiencing value in that experience. And so when we look at healthcare in the emergency department experience across the US, many healthcare institutions are trying to crack the nut on how do we keep patients within the four walls and not leave because they'll come back sicker or they'll go somewhere else. And how do we keep them engaged throughout the experience? And they're focusing on throughput, they're focusing on speed, but not too many are focusing on intentionally designing how they wait. And so we've learned from the external industries, and we have intentionally designed communication updates throughout their experience so our patients will know when labs are ordered, when labs are received, when the doctor's reading the labs, when they when they are next up to be called back to talk about their labs. And that's just one experience. But we're communicating along the way, not just what will happen, but what to expect. Because many people don't know, what does triage mean? Why can't I eat? What is NPO? And I think historically haven't done a great job of educating them on why and how. The other piece to this is that we have a captive audience for sometimes hours, unfortunately, and many of our patients do not have a primary care provider. So it's cyclical. They keep coming back to the ED. And so what we've done in that wait time, we are promoting our providers who have open panels. And so they have time while they're sitting there to learn about our physicians who would love to care for them. And so by the end of the ED, when we're ready to discharge them, we could say, hey, we see you don't have a primary care provider. Is there one within our system that you'd like? And they spent time getting to know our providers. And so we're setting them up with a follow-up visit to keep them healthy, to keep them out of the ED. And so we're exponentially improving population health, but it only happened because we learned from outside of healthcare.
Got it. And how are those updates and introductions being facilitated? Is that through a screen in the waiting area or mobile devices, or how do you deliver on it?
Yep, it's twofold. Well, threefold actually. So we have screens in the waiting room that explain the journey. We lovingly refer to it as our journey map, but it explains you're here. This is what's going to happen. This is what you can expect. We timed the average length of stay for an ED visit, and so we timed our rotating screen. So it's just enough to keep them engaged, but not enough for them to say, "Okay, I've seen this 20 times now. I'm waiting too long." So we have the screen. We also have, with the help of our EMR, a text update process. So there's triggers in the EMR that send text messages to the patients and families. And so nurses, physicians, our clinicians don't have to do it. It's not additional task on behalf of our staff, but it's all automated digitally.
Great example. Thank you for sharing that.
Yeah.
Now, I also know that you've been a strong advocate for real-time patient feedback rather than relying on post-discharge surveys. How does that immediate feedback change the way you're able to respond to patients and recover from challenging experiences?
Yeah. The discharge surveys, they tell us what happened. It's retrospect. We have no opportunity to course correct. Real time feedback, that's really what it's about. It gives us time to course correct and modify any design flaws that have been experienced and also celebrate our teams. In addition to this, the teams learn from the patients and families in real time. When you get a survey, whether it's inpatient or outpatient, ED, it's so hard to recall what happened so that you can learn and train and grow. But in the moment when we're having these conversations with the patient, you can put two and two together and connect the dots. And so, real time feedback shifts organizations from measurement to action. It creates opportunities for service recovery. It strengthens trust with the patient. It helps our business managers, our unit and department leaders to truly understand the service that they're providing and the human beings that are operating within that environment.
Mm.
And it helps our frontline team solve problems before they become lasting impressions.
Yeah. Now, from what you're describing, I'm wondering, is real-time feedback mean kind of immediately after the counter and sooner than the discharge survey? Or are we talking about like I'm still in the emergency waiting area and I'm giving feedback then?
Yeah, Chris, that's important to differentiate because in the industry, some vendors will refer to real time feedback, but it's really after the visit. What I'm talking about is in the moment. You're with me. I want your feedback on how are things going? What can we improve upon? Are your expectations being met? So
Yeah.
absolutely, while the patient and family are with us.
Now that is uncommon. I do know that for a fact. One of the interviews that I saw you involved in recently noted that hospitalized patients can interact with as many as 60 different caregivers during a stay. And I wonder, from your perspective, how, with so many different touch points, how do we get to consistency of experience that can compete with or match up to the things that we see outside of healthcare?
Yeah. It's tough. We have 44,000 staff, and 60 team members interacting on, an average of a 4.5 day stay creates a lot of room for variation and variability. And trust is built in moments and consistency is built through systems. Patients patients don't experience just a nurse or just a physician or just EVS, environmental services, which, by the way, will spend more time with the patient in any setting than any other team member. But they don't just experience that interaction, they experience one healthcare system. And so reliability comes from clear standards, co-designing the systems with both the patient, the family, and the care team so that everyone in the ecosystem has contributed to the design of that process so we don't over rotate on one experience, causing friction on the other experience, and then consistent accountability. And organizations who are have a deep value set of a culture of safety and safe to speak up sometimes struggle with accountability because it feels kind of counterintuitive, but really they go hand in hand. We have to create consistent accountability in a safe environment where people can speak up and share their experiences so that we can all grow. And so leader rounding again plays a critical role by helping leaders understand the real-time barriers, ensure teams have the tools and support they need, and then the recognition. And so all of those components together create the environment where we can have succinct and consistent systems for the patient that builds that trust. Trust is built one interaction at a time. Consistency is really, it's not accidental. It has to be intentionally engineered.
Now, I know that you've in the past talked about how your work is really about creating personalized, equitable, high value, low friction experiences. Tell us a little bit more about what you mean by friction and why that matters.
I love this topic. This is one of the questions I'm most excited about. So I think it's important first that we distinguish between friction and effort because they're often used interchangeably in some of my circles. And so friction is really what healthcare creates, and then effort is what patients and families experience when they receive care. Quite often, overcoming that friction. And so when healthcare becomes difficult, consumers increasingly will go somewhere else. If it's too hard, they're going to go somewhere else. Friction shows up as long hold times, difficult scheduling appointments, repeating information multiple times, confusing bills, poor communication. But the good news is that many of these friction points are solvable. We know they exist. They're not a surprise to us. The challenge is that healthcare has normalized many of them. And so what we found is that patient effort and friction is one of the strongest drivers of leakage. So you could have the most compassionate care team, but if the patient struggles to get in to see you, they're going to leave. And so I think when we think about leakage and patients going elsewhere, one of the greatest opportunities for us is the transition of care. That is one of the spots where most friction occurs. That the patients don't experience care in one episode. The way healthcare is often organized, they experience the journey. They move from primary care to specialist, emergency department, to inpatient or home. And every handoff creates an opportunity for confusion, additional effort, leakage. And so organizations who manage those transitions well will create significant competitive advantage for keeping those patients in their umbrella, keeping them healthier, and growing their market.
Yeah. And I think one of the important things is to recognize that healthcare is so different from other things that we purchase or have experiences with because some of those other things are by design transactions, but healthcare isn't designed to be a transaction. It needs to be more of a relationship. And I think the risk is often that it's not just that they leave and go somewhere else. It's that they leave and go nowhere else, and then come back in a much more serious condition because it's just too hard relative to all the other things that they have to juggle. And as a result, they're in much worse condition, might have to be an inpatient. It's more cost for the system and so on. So I think that's one of the big challenges that we have as well, because there are those who will fight through the friction and there are those who will just say, forget it. It's not worth the hassle, unfortunately.
You're absolutely right. I couldn't agree more.
Now let's talk about AI, the two letters on everybody's lips these days. I know you've talked in the past about how AI can help us perhaps improve communication and analyze patient feedback, but what do you think it can do to genuinely improve patient experience, and where do we have to be careful that we don't lose the relationship human part of it?
Yeah. So this is also a question that one of your listeners wrote in on LinkedIn, sent me a message and was
Good.
like, "Hey, can you guys talk about this?"
Oh, good.
So two things. One, I think we're beginning to see agentic AI help in this space. Going back to that transition of care. Unlike most AI that consumers use, just the passive AI user, which simply analyzes information, agenetic AI can take action by helping and support the patient through that transition. So think of it as sort of a digital concierge that will help you with maybe scheduling appointments or coordinated follow-up care, reminders, but it guides a patient through increasingly complex healthcare journey. It has tremendous potential, reduces effort, and creates more seamless experience. However, I exercise extreme caution because to your point, these technologies, they're still new. And my concern is whether they can consistently recognize patient sentiment, hesitation, confusion, fear, or other emotional cues that experienced caregivers will pick up on during the conversation. And so your point about going somewhere else, if AI just schedules the appointment and maybe we've reduced that effort, if the patients are still fearful or they have concerns, they may not go. And so I think AI can help us in that space, but I think we need to be very cautious. I think the other space, and we're not hearing a lot about this. When we talk about AI in healthcare, it's all about how can we help deliver healthcare. But when we think about our patient experience, it is also helping us with how consumers are finding healthcare organizations. And so when we think about shopping for healthcare, publicly reported data has been out in the across the internet for years through our CAP survey, through CMS Compare, but it's buried. And so what AI has done, it has brought awareness to transparency of data that's been there for quite a few years. And so today's patients are asking AI where they should receive care. I encourage everybody on this call, ask AI, what's the best healthcare organization in your market? And what AI is doing, it's synthesizing information from across the internet and not what your organization is saying. We can, as healthcare organizations, we can say we're the best, we know we're the best, but it's picking up patient comments, it's picking up publicly reported data. And so if your patients and families are not sharing their positive experiences online, the organization really risks becoming invisible because patients are not looking past the top 2 or 3 recommendations. And so I think from a consumer perspective, AI has significantly helped consumers shop for care. It has made fully available information that has been transparent for quite some time. And our patients are coming in more informed than they ever have before, which is causing some friction, when you have a patient who presents to their medical appointment pre-diagnosed with AI. And so I think our opportunity, taking your question a step further, Chris, I think our opportunity is training up our clinicians to have conversations when patients present with that AI. And so, not dismissing it because, patients are often building relationships with AI as consumers. And so, inviting the conversation in and saying, hey, let's look at this together. Let's talk about what applies to your situation. Dr. Stephen Beeson just shared a great short clip on how clinicians can address this. And I couldn't agree more with him. We need to invite it in and have the conversation.
Yeah, it's great points. I also believe that AI can do a lot of things to improve access. We talked a lot about friction, right? To the degree to which that friction can be reduced and get patients in. But I think we need to be careful about allowing AI to do our communication to patients. At very least, if we use it, let's disclose that because we ought to be using it in a way that fosters stronger connection and relationship between the humans involved, not as a substitute for the human relationship between them.
Oh my gosh, absolutely, Chris. And give them an option.
Right.
We can't put it in place for everyone. I think we need to give patients an option. That's my mantra. What's the option for the patient? But I love that point.
Now, I know you've also co-authored some work on the value case for improving human experience in healthcare. And I know many professionals are challenged at times, trying to demonstrate or articulate the importance of the business case around patient experience. And I'm wondering, how do you do that, particularly in organizations that might be more operations or finance focused?
Yeah. This is one that I would say is a question that is probably as old as I am. We address this question quite often. I'm very fortunate to be connected, to many different healthcare organizations and pr- uh, patient experience practitioners, new and old, and this question continues to come up. And what I tell them is, you make the case by the words you choose, and everything touches experience. And so, whether it's an operational or finance improvement, it is touching the patient. So, get involved, get at the table. Patient experience is not a hospitality initiative, it is a business strategy. And as I mentioned previously, with the addition now of AI supported healthcare shopping, it is even more so foundational to business strategy that is tied directly to relevance in the market. And so, organizations who understand this are looking at experience strategy through experience dashboards with metrics that influence loyalty and referrals, market growth, engagement, operations, and reputation. But fundamentally, when we engineer the experience, we impact retention, activation, and growth. And those are your operational and financial metrics. And so those three outcome metrics are really the baseline for business health and longevity. And as healthcare becomes increasingly consumer driven, organizations that make it easier to access and navigate care will have that competitive advantage. Consumers, they don't shop or they don't, separate quality from experience. If you have a fall, that is experience. If you, get an infection, that is experience. But for some reason in healthcare, we break those apart. We break apart operations. Here at BJC, when we put a patient experience improvement project in place, we always have an operational metric because what we do should and will directly impact the operational, the operations and the bottom line. And so making sure that as leaders, we're connecting those dots for our organization, and looking at the operational impact and inviting them into the conversation. And if you don't have support for a patient experience project or a patient experience initiative, get involved in the operations and finance as a whole.
Now, I know based on your family experience, you are a big advocate of patient and family engagement as a foundational to high reliability organizations. How can patient experience become more integrated with that effort around patient and family involvement and quality and safety efforts?
I think with every question you ask, I say this is the one that really excites me. It all excites me, Chris.
Good.
So patient and family advisory councils are, I believe, foundational to any organization. When you look at, again, outside of healthcare, they understand their market voice, they understand the different segments of their market, and they know how to reach them. And so for our patient family advisory councils, I mean, that's really what they are. Here at BJC, we have about 2,500 to include a digital advisory council. We have system councils. So when we think mother baby, our cancer service, as well as a few others, we take a very system approach because we know that our patients move, again, longitudinally. And then within our hospitals, we have our patient family advisory councils that serve the hospital. But any process, product, or policy that we put in place, we get in front of our council because, again, it has to be co-designed so we don't over-rotate here and cause friction, on the other side. And so two big things. One is that we have a co-design session 2 times a year, and we bring in our patient and family advisors. And any new product we're going to put in the market or any technology we're going to change, we bring it in, we have a conversation. And I have to give our finance team a huge shout out because they're one of the best. They are probably more connected to the patient and family experience than many other finance teams that I've engaged. But twice now they've come in and met with our patient and family advisors and said, "We're changing the way you pay your bill. How can we do this so that it's easy for you, that it's easy, to understand, and it's seamless?" And I have to tell you the progress that we're making as far as being truly patient centered and listening deeply to our patients and families has been significant. I think the other way is making sure that they're sitting on your board, they're sitting on your committees. At at Barnes Jewish Hospital, we have our patient family advisor that sits on our patient care committee of the board. And so making sure that they have a seat at the table and can provide that perspective, from on the receiving end of the care that we design.
Well, you mentioned something I think really interesting, and that's the idea of getting the finance people into the patient family advisory council meetings. I haven't heard that very often, and I would bet that that changes their perspective in many ways.
Yeah, it's really been great.
Terrific. Well, now let's take a few questions from listeners. We have one here from Martin D. Benedetto. He's asking, have you implemented real-time patient feedback? Who is responsible? How do you engage staff and gain commitment? And what have been the greatest challenges?
Okay. Yeah. So, how do we gain staff feedback? Well, you co-design it with the staff. And so they're at the table helping us develop the questions, the process, and the pathway. I think the other way that you gain feedback is, we've talked about reducing friction and effort from the patient and family, but you have to reduce friction and effort on behalf of the staff. So how much of it can we automate and get, at their fingertips? And something that we're working on here, and stay with me, let's vision this, is that the electronic medical record feeds into the real-time feedback. So we have data that can predict patient outcomes based upon what they've experienced in our care so far. And it creates a hierarchy of patients who may be at risk of having a poor experience. And so now it has taken, like a blanket approach to rounding or capturing that real-time feedback to patients that are at risk of having a poor experience so that we can intervene. And so it prioritizes the patients from high to low. So if a unit or department leader needs to prioritize their time, they can hit the ones who are most at risk. And then at the end of the day, we have a plethora of data that will tell us across the system that we can dig into by unit if we need to, but across the system, yesterday, this is what we heard was the biggest concern from our patients. This is what we heard is the biggest concern from our nurses. So it is allowing us to be nimble, and it is allowing us to quickly change. The other thing that it's doing is allowing us to put process improvement in place and to test it in real time. And so not only put it in place, then you got to wait, for a survey to come back in 2 weeks, but it's allowing us to move and flex and design as we are building it. And so reduces friction and creates ease, but it also reduces the amount of money that we're spending building out something completely could be wrong and then having to go back 2 weeks later and fix it. And so to answer the question, the buy-in is to get them at the table, co-design it together, and automate where can.
Yeah. Any challenges that are noted in your experience thus far with this?
I would say probably getting leaders on board, getting them at the table, but you're always going to have those that they don't have time or they just don't believe in it. And so probably getting, the 20% that are not really engaged, getting them engaged would probably be the biggest opportunity.
Got it. Here's another question. If healthcare organizations truly embraced a patient-centered mindset over the next 5 years, what would patients notice first that needs to feel dramatically different from where we are today? What do you think on that?
First, probably that it would feel simpler.
Hmm.
I would say patients would spend less time navigating the system, repeating information, going back to that friction and ease, chasing answers. It would just be easier. Communication would be clearer. They would have a good expectation and understanding of what's happening to them and what will happen next, and how they can prepare for it. Um, I don't think most patient-centered healthcare systems would necessarily feel more advanced. They would just feel more intuitive, I would say.
Hmm. Good answer. Now, we'd like to close each episode with this last question, and that is, do you have a favorite quote you can share? And if so, why is it your favorite quote?
My favorite quote, I have many of them, but probably the one that's most, relative to our conversation today is that every system is perfectly designed to get the results that it gets. It's meaningful to me because it reminds me that healthcare is filled with extraordinary people who come to work every day wanting to help others do the right thing for patients and families. And when patients struggle, it often is because of the systems that we produce that was designed exactly to get those results. And so if we want different outcomes, we have to reduce friction and listen to daily signals from patients and families and caregivers. And the answers are often right there in front of us again, but it's our responsibility as leaders to listen and learn and make it easier for patients to receive care and caregivers to provide it. So it would definitely be the design of the system.
Now, that's a great point. And I have, in the work that I've done, talking with clinicians, and everything I can see is they're doing their level best to try to take good care of patients and themselves. But it often feels like an American Ninja Warrior obstacle course that they have to navigate. And so we got to put the processes and systems and policies in place that make that easier and let them do what they know how to do.
Agreed.
Well, Jen, thanks so much for sharing your wisdom and insight with us today. We're so grateful for the time you spent with us. To our listeners, thank you as well. And be sure to join us for our next episode of Humanizing Healthcare. We'll be talking with Dr. Todd Otten, who is author of the book Ripple and Change, and he is executive producer of the new healthcare documentary. You may have seen it online, Suck It Up, Buttercup. I was able to preview the pre-release screening of this yesterday, and it is definitely an episode that you will not want to miss. So until then, thank you again for being part of our community, and have a great rest of your day. Thank you.